Good afternoon. Today we're going to be discussing medical errors and medical terminology for healthcare terminology 210. This is my session 5 post for the final. I want to kind of talk today about just kind of where we've gone, what we've gone through over the last 5 weeks with this course. And I believe that healthcare terminology is vital in healthcare. Knowing and understanding and being able to communicate effectively, not only with patients, but with our coworkers as well. If we as healthcare providers cannot properly and effectively communicate between each other, then it's patients that potentially suffer. As we have seen across the U.S., there is currently a bit of an epidemic with medical errors taking place. And besides the fact that it causes patients harm, in addition, it causes a monetary loss or increased healthcare costs associated with those errors as well. One of the things that we need to do to kind of keep healthcare costs low would be to eliminate medical errors. Now, as within anything, medications or medical errors of sorts have a tendency to take place. We are human beings. It is medicine. There's no standardized path. One thing that works for one patient doesn't always work for the other. So what we have to keep in mind is that we need to try and standardize when we can. One of those things is, some of our language. Medical errors are currently and now the third leading cause of death in the U.S. Not sure how this got so out of control, but studies would suggest medical errors now the third leading cause of death. I found this article from Johns Hopkins on here, and it talks about analyzing medical death rate over an 8-year period. Johns Hopkins patient safety experts have calculated that more than 250,000 deaths per year are due to medical errors in the U.S. The CDC's way of collecting national health statistics fails to classify medical errors. One of the things that they did when the International Classification of Diseases, or ICD system, was created, billing codes, at the time it was recognized that diagnostic errors, medical mistakes, and the absence of safety nets could result in someone's death. And because of that, medical errors were unintentionally excluded from the national statistics. So it's not something that we do on a regular basis, is calculate what types of medical errors, medical mistakes are being done, and then what they are. We just know a total average. According to this article that I found, and this is on the NEHI.net website, each year in the U.S., serious preventable medication errors occur in 3.8 million inpatient admissions and 3.3 million outpatient visits. Inpatient preventable medication errors cost approximately $16.4 billion annually, and another $4.2 billion annually for outpatient preventable medical errors and medication errors. Dosing errors, we talked about that in this program in session 3 with the scenario about a medication error. And I have to say, it kind of touched me personally with this because of stories that I had heard, issues that patients have had, and other coworkers have had regarding medication errors. And one of the things is a lack of communication. Oftentimes a medical error can take place, or a medication error, just simply because we didn't communicate effectively between parties. In the U.S. National Library of Medicine, I found this article as well, The Economics of Medical Errors. And in 2008, medical errors cost the United States $19.5 billion, about 87% or $17 billion, were directly associated with additional medical costs, including ancillary services, prescription drug services, and inpatient and outpatient care. When we talk about that in that scenario, the patient ended up being okay, but they had to run some more tests, they had to do some more stuff. That's where that increased cost in healthcare is coming from. And it's the increased cost to the patients. But if patients don't have perhaps the right kind of insurance, or something was going wrong, that cost is attributed onto everybody else. The hospitals can't absorb the cost of taking care of that and those patients all the time. So, we talk about medication errors. And again, communication is the biggest piece. Communication in anything is what determines your outcomes. And if we cannot effectively communicate, then we end up with problems. And according to the Joint Commission, they are the accrediting body, they have a do not use list. That's their official do not use for abbreviations. One of the things in healthcare that we notice all the time is people are always doing shorthand, right? We're always trying to make things a little bit easier, a little bit better. U for unit can be mistaken for things like a 0, the number 4, CC. We need to be able to write unit. Now, in today's world, with all of the technology that is out there, and auto replace text functionality, things like that, there's really no reason why we can't just put unit. Why do we need to shorten everything out? Make sure that those items are in a patient's chart correctly the way that you want them, so there's no miscommunication. And hopefully we can lead to a reduction in healthcare mismanagement. One of the between the 700,000 and 1 million falls that take place in hospitals each year. How is that being documented? How is that stuff? I think that we can, as healthcare providers, communicate more effectively and let shift change folks and transitional care know and understand that patients are at risk. And if we do that and we can effectively communicate that, I think that we can reduce errors. So as a whole, I keep coming back to this. It's communication and the ability to effectively communicate. Physicians to nursing staff, CNAs, administrators, across the board. We need to make sure that we know and understand what everybody's talking about so that we can help reduce medical errors and help reduce billions of dollars spent annually on preventable errors. 19.5 billion in 2008. Thank you very much. Here are my references for those articles that we discussed. Johns Hopkins, this study suggests medical errors now the third leading cause of death. The NEHI .net article, Preventing Medication Errors, and the U.S. National Library of Medicine.